Thinking about dental implants in the Dominican Republic? In this video, we're breaking down 4 key decisions that can make or break your dental implant experience.
First of all, maybe you could tell us your name and your educational background, just a little bit of your journey as a dentist.
So I'm Dr. Josue de Leon. I'm from Dominican Republic. I made the study over here at Punta, the dentistry degree, and I made the PhD at Brazil in the University of Sao Paulo and also CPO. My PhD is in rehabilitation, oral rehabilitation practices, and implants.
Why Brazil? Why did you choose Brazil?
Why? I choose Brazil because it's the best destination to do the PhD degree on implants and oral rehabilitation for practices, and also the aesthetic specialty. They are the best on aesthetic rehabilitation.
What about the brands that you work with? For example, maybe dental implant brands, maybe you could take us through them.
So we use Miss implants and also Sin implants. That's from Brazil.
Is there a reason that you're just working with them exclusively?
Yes, we just work with those 2 brands, and also I think 90% of the country is working with those brands.
Is there any difference in the quality, let's say, of Miss implants versus, the common names that you do get to hear like Straumann or Noble Biocare? Is there any difference?
For now, I don't have any difference from them because in Brazil, I used to work with the Straumann exclusively because that was the brand that sponsorship the university. But now that I work with Miss Implant here in the Dominican Republic, I don't see any difference because the final result is the same. The prices are cheaper. Also, we give the patient a writing 10 years warranty with the implants. If they have any situation when they come back, we put the implants back, but we don't do often a second surgery after we put the implants because the implants are very good. They have very good results, and that's why we give 10 years warranty on the implants.
You also do bone grafts at the clinic?
Yes, we do bone graft in patients that need it before doing the implants. For the bone graft, it is needed a CT scan, it is needed a blood test because we need to see if the patients apply for the procedure. The bone graft sometimes is made before the implants and sometimes is made also with the implants. We can make in some surgeries the implant and the bone graft, but some surgeries gotta be done the bone graft first.
Is it better to get it done while getting the implants or before it? Like, what's the difference?
Getting the bone graft first and after that the implants, it will depend on your case. Why? Because some cases doesn't have bone, so we cannot put an implant over there and also put the bone because it will lose everything on the healing period. So we do the bone graft first. We let the bone graft heal. It takes 6 months to heal a bone graft, and after that, we make sure that the bone graft is already healed and is all, and they don't lose that. And after that, we make sure that we can put the implants. As I said to you, we give 10 years warranty, but in some cases, like bone grafts, the percentage of successful for the bone grafts is not only depending on the surgeon skills, it depends on the body of the patient receiving that bone graft. So we don't give a 10 years warranty on bone graft, but on implants and everything else, yes, because the percentage on bone graft is like 65% when doing with a good surgeon and good materials.
You mentioned that for a smile makeover, it takes 5 days, right? Like that's roughly the amount of time a patient needs to be there for. What about all on 4, all on 6, and in case I need a bone graft as well? How many days should a patient plan to be in Dominican Republic for?
Well, for the patients that don't send to us, the CT scan before coming here, we are around all those tests over here when they get in here. So what I tell my patients is has to come at least 21 days. Why? Why so many days? Because in dental implants, we gotta see the CT scan if they apply. We gotta see the blood test. And in the blood test, if we see a problem in the blood pressure, if we see a problem on the sugar levels, we indicate and we refer the patients to a doctor to control them. And after the doctor control the situation, we start the surgery. Before that, we don't work on patients that got a health problem, because it is not good for the patient to work if they got the high blood pressure or sugar levels high. So we try to control everything in those 21 days, because we want the patient to go and fly back home with the new smile, the all-on-4, the all-on-4, all-on-6 done in their trip here in the Dominican Republic, because it's not the same working over teeth and working over implants or on implants. When you do a smile makeover, you use a little bit of anesthesia, but it's not the surgery. When you do a surgery on a patient that you got blood running on, that you gotta put a lot of anesthesia on, you gotta make sure that the patient is able to receive an implant and do a surgery.
That's so sweet, actually. Not a lot of clinics go out of their way to ensure that the health of your patient is on track before the surgery. But a lot of patients might also feel like, 21 days is a lot of days to be away from home. So in case they do have their blood reports in place and all the medical conditions are okay, how many days then would all-on-4, all-on-6 and maybe a bone graft take?
If they send us the blood test, the CT scan before coming here, and we see everything and everything is okay, I mean, they will get here, they will get the surgery. Getting in here, 3 days could be perfect for us. But as I said, we got a political rule as a clinic. Even the patient sending the blood test out of the country, we gotta repeat it here. Why? Because some patients, they make false results just to get the surgery done. So we gotta make sure with our laboratory making a new blood test, verifying that everything is right. So if everything is right, we can continue with the surgery in the second day, and after 2-3 days of healing, you can go back to your country.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.